Yes. Hello. I'm Enrico Ascher, and I would like just to talk a little bit about how the VEITH Symposium started. And for historical purposes, I might say that the VEITH Symposium was the first vascular symposium in the world ever designed, and was designed and run initially in the first few years by a pioneer in vascular surgery called Henry Heimovici. Dr. Heimovici was the chief of vascular surgery at Montefiore Hospital in New York City. And then when he retired, Dr. VEITH, Frank VEITH, took over. And at that time, Dr. VEITH was also doing vascular surgery and transplant surgery. And, but he's an excellent and very innovative educator. So he took that meeting and transformed it from a meeting for 100 people to a meeting initially to 500, 1,000, 2,000, 5,000 people, and the most. And how did he do that? He did that with a lot of innovations in the way the presenters present their work, in the time that they have. Instead of the 15, 20 minutes that each speaker had in the past, he went down to 5-6 minutes, because he wanted to just send us the important message. You don't have to bring slides that are not really important for the audience. And then becomes a very dynamic meeting, and that now has been imitated all over the world. Everybody now just have the same things. The other thing is that Dr. VEITH had invited speakers that are not necessarily vascular surgeons only. He invited cardiac surgeons to talk, because each one of them had a different area and something that he can contribute. So he had the first idea of having a multidisciplinary meeting to talk about the management of vascular diseases. And that included cardiologists, interventional cardiologists, radiologists, vascular medicine, the so-called angiologists in Europe. So having a conglomerate of experts, even from different specialties, including hematologists, made this meeting very, very attractive. And now it has been expanded to a point that not only we run 3 ballrooms about vascular diseases, but we have also other 8 rooms where we talk about specific areas for people who like to talk about one or other subject. So there is a variety of programs ongoing constantly at this meeting. And the most important thing is that we feel that vascular surgeons, there's no difference between a vascular surgeon from the US or from China or from France or from Egypt. We all are doing the same thing. We all want the best for our vascular patients. So what better than to feel that we all globally are a big family. So basically here is a roof for vascular surgeons globally, and that's what we'll continue. Our intent is not to work for the industry, although industry is very important, because industry creates and produce the instruments that we're gonna use to help our patients. So how they cannot be involved? They have to be involved, but in a very professional way. They don't select what we say, we select what we say, but if we don't know what they're doing, how are we going to choose what the best to present in the meeting? And the meeting is a very dynamic meeting. As I mentioned, it changes all the time. And, but the basic fundamental thing is to be the best educational platform we can do. And for this, we work the entire year. A group of us work year-round, so to make it better.